The equipment you will find at the station for taking blood glucose are gloves, tissues, a set of instructions, some alcohol swabs, the blood glucose meters, lancets, and the sharps bin. In order to take your blood glucose, pick which finger you'd plan to use. I would suggest using the non-dominant hand, and then warm the finger by rubbing it. Next, take a glucose test strip out of the cylinder. You will notice that these test strips have two ends. One has a set of copper electrodes on one end, and the other end has a grey test strip with a small yellow stripe in the middle of it. This is the end that will collect the blood. You place the copper end into the small slot of the glucose test meter. The meter will turn on when you do this and display a code. After this, a symbol which indicates that the unit is ready to collect blood will appear. In order to measure blood, you will need to collect the blood horizontally. Do not dab the blood from the top of the test strip. Instead, move the strip towards the blood from the side. We will demonstrate here. First, take an alcohol swab and swab your finger. This will sterilize your finger to prevent infections. Next, take a lancet. These are the lancets. You will notice that there are 3 markings on the grey body of the lancet, shown here. These are for shallow, medium, and deep penetration settings. You will also notice on the purple part there is a small triangular cutout. This is the setting of the lancet. Here we have turned the setting to shallow. Remove the end plug, place the flat part of the lancet against your finger, and press the purple button on the top. You will hear a click when the needle discharges. Squeezing the finger around the site of the pinprick usually helps the blood to appear. Once you have your droplet of blood, pick up the glucose meter, ensuring that it is still displaying the ready symbol, then approach the blood from the side. You will notice the blood drawn into the sampling chamber shown here. The machine will beep, then in 5 seconds will display your blood glucose reading. Record this value in your notes. You may then remove the test strip from the glucose meter and dispose of this in the biohazard bag. Wipe your finger with either alcohol swabs or tissues. Dispose of the lancets in the yellow sharps bins provided. Do not dispose of any tissues, alcohol swabs or gloves in these bins. Please place them into the biohazard bags provided. If you need to help anyone else with their blood sampling, make sure that you put on a pair of the gloves provided first. You are now ready to proceed with this activity. Please see the demonstrators if you need any help.